Good morning, guys. I wanted to go ahead and do part 2 of our short little going over our PowerPoints for this last part of class for test 3. This time I'll be talking about pediatric musculoskeletal disorders. Again, I'm going to skip over the first couple slides. Just know that this is a common reason that patients are evaluated, and that the reason that musculoskeletal is a big deal in peds is because we have a whole other set of problems related to their growth and development, just in general. So A and P, like I said, I'm going to skip over. The history of present illness, you'll want to read over these. Same with a generic physical exam for musculoskeletal. Again, these are not necessarily something you specifically need to know, but this will help you when you're trying to do those application questions on the test. You'll want to be able to discuss the difference between the Barlow and Ortolani. Again, there is a difference, and please make sure for this section of the notes that you pay attention to the actual notes section in this PowerPoint. There's quite a bit of useful information down there in the bottom that will help you on the test. So again, the difference between the Barlow and Ortolani, and also being familiar with the Galeazzi sign. Back pain, specifically you'll want to focus on scoliosis and understanding how to diagnose this, and what different tests you would use. For example, in here on the PowerPoint it talks about the scapular prominences, the Adams test, the scoliometers. That is something specific you'll want to know. And then there is a PowerPoint from one of our ortho physicians that works at the school, from Dr. Adams, so please take a look at that as well. I did say that that was something that was required to know for this test. You want to know treatment goals for scoliosis. Fractures, just be aware of the growth plate. I don't know that we have specifically a question on there, but just I would take a look at that for just in case there is. For strains and sprains, you'll want to know the Ottawa rules, and you will want to know the actual rule and the actual measurements that are on slide 23. You want to know how to treat strains and sprains. Torticollis, you'll just want to be familiar with what that looks like and what the treatment plan for that is. Same with the nursemaid elbow, you'll want to know what that looks like and what the treatment plan is. You want to be familiar with childhood limps and when to refer and when to just kind of watch it. Make sure you know that you need to order labs to assess, because there are quite a few musculoskeletal issues that do present with a limp. You'll want to know the transient synovitis. Most commonly, these patients present with some kind of upper respiratory infection that then progresses to awakening at night with a painful limp and refusing to walk. You want to know how to do the hip exam. You want to be aware of developmental dysplasia, again, what that looks like. There is not a specific question on the test, but you'll need to be able to differentiate that from some of these other disorders. You want to know septic arthritis and septic hip. You want to know how to manage that, and again, how to differentiate that from some of these other conditions. One of the differentiations with this is the patient does not present with any kind of redness, warmth, or swelling. You want to be familiar with labs and know what would truly make somebody septic. And then treatment plan for this is IV antibiotics for 2 to 4 weeks. You'll want to be aware of the slipped capital femoral epiphysis. Again, this is another one that presents with a limp. You'll want to be able to differentiate that from these other conditions. The biggest thing with this is most of these kids are overweight, usually greater than 80th percentile, but typically you'll really start looking at it with 85% and above. They're often presenting with a painful limp, and then their leg is externally rotated as well. You don't really need to know on the x-ray portion for this, just know that you need to refer to ortho. Leg calf Perth, the same kind of thing. They present typically with a limp with limited range of motion. For this one, they may have been limping for a while before the family will come to visit you. Just make sure that, you know, they don't have a lot of pain, they do have decreased range of motion, and you have to know how to differentiate this one from these other conditions as well. Overuse syndromes, this is typically your Osgood-Schlatter disease. Be aware with this one that They do have pain with activity. The pain typically goes away with rest, and it is okay for them to play through the pain, and that is a really important teaching point because a lot of parents are going to want their child to stay at rest, and it's not necessary. They really should play through the pain. Growing pains is another one. You'll want to know that this is a normal condition, but you do want to get a set of labs to rule out any kind of serious pathologies such as leukemia or tumors. This is kind of the most important thing with this because a lot of kids are going to present to the office with this. Osteosarcoma, I don't think there's any questions on that on the test, but again, take a look over that for just in case. That way you can use it for your differentials. For femoral anteversion, this will be something on the test. Make sure you know how these children usually present and how they're usually walking. Usually they're sitting in that W in front of the TV. We call it the TV squat. You want to be familiar with internal tibial torsions and knowing that, you know, this is something that mostly gets normal within 6 to 9 months of walking, and try to discourage the children from sitting on their feet on the floor. For toe walking, this is not on the test. Just know that this can be a normal pattern. But then the heel toe should establish after about 6 months of walking. Costochondritis, this was tested in the cardiac portion, so you will not need to know this for the test. And then muscular dystrophies, this is where you would need to be familiar with the toe walking. And then the most important thing with muscular dystrophy is that, you know, kids are failing to reach milestones or they're starting to lose their motor skills. And then automatic referral is necessary for that. So that's kind of our brief overview of the musculoskeletal disorder. I will have another one for the Peds urological disorders. That will probably come out either later tonight or over the weekend. And I will not be putting one out for skin since we talked about that in class. So please make sure you take a look at your notes, read over those kind of buzzwords that I talked about, because a significant portion of the next exam is over Peds dermatology. So we're almost there. You guys are doing a great job, and hopefully you'll find these short little videos kind of a helpful way to focus on what to study. That way you can dive into what you feel like you need to differentiate and study a little bit more outside of class. So I hope you guys have a good day. Bye.